Are you taking diabetes medication and feeling more tired than usual? Maybe you've noticed tingling in your feet that won't go away, no matter how well you control your blood sugar. What if I told you that 3 specific vitamin deficiencies could be causing these problems, and your diabetes medication might actually be making things worse? Today, we're going to talk about something your doctor might not have mentioned: the hidden nutrient gaps that affect millions of Americans with diabetes. Stick with me because understanding these 3 vitamins could be the difference between just managing symptoms and actually feeling better. Let me start with something that catches a lot of people by surprise. You go to your doctor, you get prescribed metformin for your diabetes, and you start taking it faithfully. You're doing everything right. But a few years down the road, you notice something's off. Your feet are numb. You're losing your balance. You're forgetting things more often than you used to. And here's the frustrating part. Your doctor might chalk it up to aging or blame it on your diabetes getting worse. But there's another explanation that often gets overlooked. Here's what happens. Metformin is an excellent medication for managing blood sugar. Millions of Americans take it, and it's been the first-line treatment for type 2 diabetes for decades. But it has a side effect that not everyone knows about. It interferes with how your body absorbs certain vitamins, specifically vitamin B12. And this isn't just happening to a handful of people. Research indicates that long-term metformin use is associated with increased risk of B12 deficiency, especially after several years of treatment. Think about it this way. You're taking a medication every single day that's helping one problem, but quietly creating another. Your body needs B12 to protect your nerves, make red blood cells, and keep your brain functioning properly. When you don't have enough, things start to break down. The tricky part is that the symptoms develop slowly. You might not notice anything for years because your liver stores B12. But once those stores run out, problems start showing up. Now here's where it gets really confusing for people with diabetes. The symptoms of B12 deficiency look almost identical to diabetic nerve damage: numbness in your feet, tingling in your hands, balance problems, weakness. If you're already dealing with diabetes, how are you supposed to know which condition is causing what? This is why some people end up treating their neuropathy without ever realizing they have a vitamin deficiency that could be addressed relatively easily. Let me give you some real numbers so you understand the scope of this. Studies show that people taking metformin for 4 years or more have significantly higher rates of B12 deficiency compared to those not taking the medication. The longer you take metformin and the higher the dose, the greater your risk. If you're taking more than 1,000 milligrams daily, you need to pay extra attention to this. But it's not just metformin. Your age matters too. After 60, your body naturally becomes less efficient at absorbing B12 from food. So if you're over 60 and taking metformin, you're facing a double challenge. Add in other medications like proton pump inhibitors for heartburn, which are extremely common in older adults, and you're looking at a triple threat to your B12 levels. Drop a comment if you're currently taking metformin. How long have you been on it? Have you ever had your B12 levels checked? So what does B12 actually do in your body? This is important to understand because once you see how crucial it is, you'll understand why protecting your levels matters so much. B12 is essential for making myelin, which is like insulation for your nerves. Without adequate B12, that protective coating deteriorates. Signals from your brain to your muscles and back don't travel properly. That's when you get numbness, tingling, and balance problems. Your brain needs B12 too. It helps make neurotransmitters that regulate mood and cognition. When levels drop, some people experience depression, memory problems, or that foggy-headed feeling where you just can't think clearly. And here's something many people don't realize. Your body needs B12 to make red blood cells properly. Without enough, you develop anemia where your red blood cells are too large and don't function well. You end up exhausted even though your blood sugar might be perfectly controlled. There's another compound worth mentioning called homocysteine. It's an amino acid in your blood. B12 helps break it down and keep levels normal. When B12 is low, homocysteine builds up. Elevated homocysteine is linked to increased risk of heart disease and stroke. For someone with diabetes who already faces higher cardiovascular risk, this is particularly concerning. Now let's talk about solutions because that's what really matters. The good news is that addressing B12 deficiency is usually straightforward. If caught early, oral supplements often work fine. Many people do well with doses between 1,000 and 2,000 micrograms daily. That might sound like a lot, but B12 is extremely safe. Your body uses what it needs and eliminates the rest through urine. There's no established upper limit for B12 intake. For more severe deficiencies, or if you're having trouble absorbing oral supplements, your doctor might recommend B12 injections. These bypass your digestive system entirely and deliver the vitamin directly into your bloodstream. People typically get injections weekly for the first month, then monthly for maintenance. Many people report feeling noticeably better within weeks, especially if they were experiencing nerve symptoms or fatigue. Here's an interesting tip that's backed by research. Taking calcium supplements alongside metformin may actually help improve B12 absorption. Some studies suggest around 1,200 milligrams of calcium daily can make a difference. It's a simple addition that might help protect your B12 levels if you're on metformin long term. What about food sources? Beef liver is extraordinarily high in B12. A 3-ounce serving provides several thousand% of your daily needs. Now, I know not everyone loves liver, but even having it once a week or every other week can make a significant contribution. Clams are another powerhouse. Sardines, salmon, eggs, and dairy products all provide good amounts of B12. If you're vegetarian or vegan, you'll need to focus on fortified foods like nutritional yeast or take supplements, because B12 is found almost exclusively in animal products. If you're enjoying this information, hit that like button. It helps more people find evidence-based health content. Now let's move to the second vitamin that's crucial for people with diabetes: folate, also known as vitamin B9. This one's a bit more complicated because there's confusion around folic acid versus folate and how your body processes them. Let me break this down in a way that makes sense. Folate is the natural form of vitamin B9 that you find in food: leafy greens, legumes, citrus fruits. Folic acid is the synthetic version used in supplements and fortified foods like cereal and bread. For most people, the body converts folic acid into its active form called methylfolate, which is what your cells actually use. But here's the complication. A significant percentage of people, perhaps up to 40% globally, have a genetic variation called MTHFR that affects how efficiently they make this conversion. For people with diabetes, folate matters for several reasons. First, if you're taking metformin, it can lower your folate levels. Not as dramatically as it affects B12, but enough to be noticeable over time. Second, folate works together with B12 to control homocysteine levels. Remember, elevated homocysteine increases cardiovascular risk, which is already a major concern for diabetics. Third, folate is essential for nerve health and energy production at the cellular level. The symptoms of folate deficiency can overlap with B12 deficiency: fatigue that doesn't improve with better sleep, brain fog and difficulty concentrating, mood changes including depression and anxiety. And here's something really important to know. High doses of folic acid can actually mask the signs of B12 deficiency in your blood work, which means you could have serious B12 deficiency causing nerve damage while your test results look deceptively normal. This is why it's crucial to check both vitamins if you're experiencing symptoms. Research suggests that people with diabetes and low folate levels often have elevated homocysteine. Studies indicate this combination significantly increases cardiovascular risk. But when folate status improves, homocysteine levels typically drop, which may help protect your heart and blood vessels. So how do you maintain healthy folate levels? Start with food. A cup of cooked spinach provides about half your daily folate needs. Lentils are excellent, delivering substantial folate along with fiber and protein that help stabilize blood sugar. A cup of cooked lentils gives you well over half of what you need for the day. Asparagus, broccoli, Brussels sprouts, and citrus fruits are all good sources. Fortified cereals can provide significant amounts of folic acid, often meeting or exceeding daily requirements in a single serving. Just watch the sugar content if you're managing diabetes. You want cereals that won't spike your blood sugar. When it comes to supplements, this is where things get interesting. Standard folic acid supplements work fine for many people. The typical dose is 400 to 800 micrograms daily. But if you have that MTHFR genetic variation, or if you're not responding well to folic acid supplements, there's an alternative called methylfolate or L-methylfolate. This is the active form that your body can use directly without needing to convert it. It bypasses the potential bottleneck created by the MTHFR enzyme. Now, there's a lot of misinformation online about MTHFR and folic acid. Some sources claim people with MTHFR mutations absolutely cannot process folic acid and must avoid it completely. According to the CDC, this isn't accurate. People with MTHFR variants can process folic acid. They just do it somewhat less efficiently. But if you're concerned or if you're not seeing improvement with standard folic acid, methylfolate supplements are a reasonable option to discuss with your healthcare provider. One more important point about folate. Unlike B12, your body doesn't store large amounts. You need regular intake. Any excess gets eliminated in your urine. This makes it generally safe, though very high doses over extended periods might cause issues, particularly if you have kidney problems. Tell me in the comments, have you had your folate levels checked? Many people have never had this tested, even after years of taking diabetes medication. The third vitamin we need to talk about is vitamin B6. Specifically, we're talking about the active form called P5P, which stands for pyridoxal 5-phosphate. Just like with folate, there's a difference between the form you typically find in supplements and the form your body actually uses. Most B6 supplements contain pyridoxine. Your liver has to convert this into P5P before your cells can use it. For most people, this works fine, but research suggests that some individuals, particularly those with liver dysfunction or certain genetic variations, have difficulty making this conversion efficiently. For these people, taking P5P directly might be more effective. Why does B6 matter for diabetes? Several reasons. First, P5P is involved in how your body breaks down glycogen, which is stored glucose in your liver and muscles. When you need energy, glycogen gets broken down into glucose, and P5P helps regulate this process. This means it plays a role in glucose metabolism and helping your body use sugar efficiently, rather than letting it accumulate in your bloodstream. Second, P5P supports insulin function. It helps with insulin secretion from your pancreas and improves how your cells respond to insulin. For someone with insulin resistance, which is common in type 2 diabetes, optimizing B6 status might help improve insulin sensitivity. Studies indicate that many people with diabetes show some degree of B6 deficiency, and addressing it may support better blood sugar control. Third, and this is huge for people with diabetic neuropathy, P5P is essential for nerve health. It helps maintain the myelin sheath that protects your nerves. It's involved in producing neurotransmitters that regulate mood, including serotonin and dopamine. Low B6 levels have been associated with increased anxiety and depression, both of which are more common in people managing chronic conditions like diabetes. And once again, we're back to homocysteine. P5P, along with B12 and folate, helps convert homocysteine into other beneficial compounds. All three of these B vitamins work together as a team to keep homocysteine levels in check and protect your cardiovascular system. Metformin can affect B6 absorption too, though not as dramatically as it affects B12. But over time, particularly with higher doses and longer duration of use, B6 levels can decline. Add in aging, which reduces absorption efficiency, and you've got another reason to pay attention to this nutrient. Food sources of B6 include tuna, salmon, chicken, turkey, potatoes, and bananas. A 3-ounce serving of tuna provides roughly half your daily B6 requirement. Chickpeas are a good plant-based source, but if you're looking at supplementation, typical doses range from 25 to 100 milligrams daily of P5P. For people with severe deficiencies or significant nerve damage, doctors sometimes recommend higher doses, but this should be done under medical supervision. Unlike B12, which is incredibly safe even at high doses, very high amounts of B6, particularly over 500 milligrams daily for extended periods, can potentially cause nerve problems. So more isn't always better. Stick to reasonable doses unless your healthcare provider specifically recommends otherwise. Here's what I want you to take away from all of this. If you're managing diabetes, particularly if you're on metformin, your risk for these vitamin deficiencies is higher than the general population. The symptoms, numbness, tingling, fatigue, brain fog, mood changes, these can all be attributed to diabetes itself or aging, but they might actually be preventable or reversible vitamin deficiencies. The smart approach is regular testing. If you're on metformin, especially for more than a couple years, ask your doctor to check your B12, folate, and B6 levels. This is a simple blood test. If levels are low or borderline, supplementation is generally straightforward and safe. Catching deficiencies early prevents more serious complications down the road. Here's something else worth mentioning. Insurance coverage for vitamin testing varies. Medicare typically covers B12 testing when there's a medical reason, such as symptoms of deficiency or long-term metformin use. If cost is a concern, discuss this with your doctor. They can help prioritize which tests are most important for your situation. Think about your diet too. Are you getting regular servings of fish, eggs, dairy, leafy greens, and legumes? If not, your dietary intake of these vitamins might be lower than ideal even before considering absorption issues from medications or aging. Small changes, adding salmon once a week, including more spinach and lentils, choosing fortified cereals, these habits add up. For those of you on fixed incomes, I understand that supplements are an extra expense, but B vitamin supplements are generally affordable compared to many other health costs. A bottle of B complex that includes B12, folate, and B6 might cost $10 to $15 and last a month or more. When you weigh that against the potential complications of deficiency, nerve damage, anemia, increased cardiovascular risk, it's a worthwhile investment in your health. If you're working with a registered dietitian or nutritionist, bring up these vitamin concerns. They can help you develop an eating plan that maximizes your intake of these nutrients while still managing your blood sugar effectively. It's all about finding the right balance for your individual situation. Let me be clear about something. These vitamins are not going to cure diabetes. They're not going to replace your medications. What they can do is help you feel better, reduce symptoms that are making life harder, and possibly lower your risk of certain complications. When you address nutrient deficiencies, you're giving your body the tools it needs to function as well as possible while managing a chronic condition. This is educational information, not medical advice. Everyone's situation is unique. Your medications, your other health conditions, your age, your diet, all of these factors influence what's right for you. Work with your healthcare team to figure out if testing is appropriate and what supplementation strategy makes sense for your specific circumstances. Before you go, I want to hear from you. Have you experienced any of the symptoms we talked about? Nerve problems, fatigue, memory issues? Have you had your vitamin levels checked? Drop a comment and share your experience. Your story might help someone else realize they should get tested. If this video gave you useful information you didn't know before, hit that like button. It tells YouTube to show this content to more people who might need it, and share it with anyone you know who's managing diabetes. This is information that could genuinely improve someone's quality of life. Subscribe to this channel if you want more evidence-based health content, specifically for people over 50. We're not selling miracle cures or making unrealistic promises. We're just providing practical information that helps you make informed decisions about your health. Managing diabetes is challenging enough without dealing with preventable vitamin deficiencies on top of it. You deserve to feel as good as possible. Sometimes that means looking beyond blood sugar numbers and considering the whole picture of what your body needs to function well. Thanks for watching. Take care of yourself. And remember, small steps, regular testing, thoughtful supplementation, good nutrition, these things add up to meaningful improvements in how you feel day to day. I'll see you in the next video.